Today we are here with Saju Varghuese, who is or was a caregiver to his mom. And now we're going to hear from Saju. Saju, can you start off by telling us your cancer caregiver story, where it all started?
Yeah, I can't. It's we're about a year's out now, a little more than that. So I guess thinking back to the story, you never really expect this, something like this to happen to your family. And so my mom, my mom and my dad went to India, back in like the winter of 2019. They returned from that trip and she wasn't feeling well. And she had lost weight. So, you still aren't thinking, I work in oncology, and you're still not thinking that something like that's going to happen to your family. And so, and she's a nurse herself. So she's also in healthcare too. So she wasn't feeling well. She saw her primary care after she came back from her trip, was put on an inhaler because she had some difficulty breathing. And, that improved, but her stomach pain continued to progressively get worse to a point where one day she just, she's like, I need to go to the emergency room. So that's when I knew, oh no, this is, something bad. And even at that point, still not thinking cancer, thinking maybe a GI bleed, maybe a stomach virus that's really bad, C. diff, that's not, you're not thinking cancer, the big C. And so I remember driving down to New York. I live in Philadelphia, so I drove up to New York. Met them at the hospital, and at that point she was still just in the emergency room. We went to my brother-in-law's hospital where he works, so she can easily get into a room. She's not waiting in the waiting room forever, the emergency room forever to get her scans and stuff. So by the time I got there, she still hadn't gotten her CAT scans or anything like that. So I'm like, okay, I'm gonna go home. I'm gonna go cook up some soup because she doesn't seem to be holding much things down. I'm sure they don't have food at home. By that point, they'll get her scans and we'll bring her home. That was not what happened. So I'm home. My brother-in-law calls me asking me when I'm gonna come back to the hospital, and I'm like, why would I come back to the hospital? So I knew immediately at that point that it was something really bad. So, so we, there's all these phases, right? So first you find out it's cancer, and they have this preliminary diagnosis of what they think it is before a biopsy and things like that. So originally they thought it was pancreatic based on where the mass was in her abdomen, because it was over her spleen and part of her pancreas. So there's no such thing as spleen cancer, right? So it was a fair assumption that that's what it was, with multiple other sites involved. So metastatic, so stage 4 at that point. So that's a pretty devastating preliminary diagnosis. So that was the first stage. And then we got to the hospital. We didn't tell my dad at that point because it was already late. It was a lot to process. So, and my mom was like, absolutely not. We're not telling him just yet. I think she needed her time to process as well. So that was the first night of from the initial symptoms to getting diagnosed to getting the preliminary diagnosis, right? So after that, my parents, were waiting for the biopsy. We had to do a biopsy of it all. I remember the first night being the healthcare person working in cancer. I sat up all night thinking of a differential diagnosis.
Yeah.
Because I had to. I wasn't accepting. I just was not accepting that this is pancreatic cancer. I just could not.
Right.
It was tough.
It's a blessing and a curse to have that knowledge, right? Yeah. To have the oncology background. Yeah.
So I sat there because I knew what the doctor said, that evening, where are all the sites, what they see. I mean, I didn't necessarily see the CAT scan myself. They just kind of told me approximately where things were at. So on that list of things were what her real diagnosis ended up being, which is just kind of crazy to me. I was like, and I remember going the next day with this list of differentials and them kind of laughing at me. This is a community hospital, right? This is not an academic like MSK, just a community hospital in Long Island. They kind of were like, it's definitely not lymphoma. I remember you can accept that right now. So I was like, okay, me just being naive, I was like, sure. I mean, I didn't think much of it because, I think you kind of forget your clinician piece. You just want to be, the kid, like the child, the family member, and you don't want to be like the pharmacist or, the healthcare person. So you're like, okay, you accepted that. And so the longest waiting period was waiting for the biopsy results. I think that, you get the biopsy and that feels like forever.
Right.
You can't really do anything. You can't really, you can't go see the specialist because you don't know who the specialist is. You don't know.
Right.
Like you want to make that appointment at MSK or like big cancer center, wherever you're at, but you can't because they specialize down to even if it's a kidney, the specific kidney type of cancer, even if it's blood cancer, is the specific blood cancer, right? So you can't necessarily go and make an appointment without knowing what it is. So that felt like forever. And I remember,
I'm going to just ask a question. So during that time of waiting for the biopsy, were you able to take off your pharmacy hat and put on your son hat during that time and kind of be there with the family and kind of go through
Sure. Yeah. So, I mean, I think after the initial shock of it all, you just kind of, for me and my family, we're pretty like, our faith is pretty important to us. So really like leaned into our faith. And then also try to figure out what do we tell other family members because, especially like just the immediate family knew, just like my siblings, my in-laws, only we knew, but like, we're like, we do need to tell my aunts and uncles, they need to know what's happening to their sister, their sister-in-law. So we're like trying to figure, and at the same time kind of balancing out like, how much do we tell? We don't even know what it is. And so just kind of, balancing it all out. It was a good time, like that first couple of days, the way in the beginning. I remember everyone kind of came to my parents' house and we all stayed there until as close to the diagnosis from the biopsy was. Like we were all together. We also, and then after the shock wears off, you're kind of in, I go into action mode. What are we going to do? It is what it is. We're going to move forward as a family and figure it out. My dad is also is immunocompromised because he had a kidney transplant. So he couldn't be the primary caretaker for my mom. Mm-hmm. My sister just had a child earlier that year. So she had her hands full with a new infant, and my brother had just gotten married in November. And had just moved to New Jersey. So, and I was the oldest in the family. So, and I was single and I had the ability and thank God the job to be able to work remotely wherever I was in the Northeast. Right. So I was able to pretty much uproot my life from Philadelphia and move in with my parents. And I just, you just do. You don't think. You just do.
Right.
Moving back in with your parents at like 30 plus years old, you're just like, God, it's going to be fun.
Yeah.
But, you kind of you're just, again, in do mode. You're not worried about all the stuff that's coming along with that. We also got the chance to do like family photos. I remember that. Like we knew whatever the chemotherapy was, most likely my mom would lose her hair. So, she said it wasn't important to her, but we know her better than that to know that that's going to impact her pretty much. And we wanted to do like pictures because, we had a new sister-in-law, we had a new nephew. We hadn't done like family pictures in a really long time. So we did do family pictures at the house. The photographer came to the house and did them all, did all those and was, we still have them today. My mom keeps referring to them as her skinny days. Because she had lost a ton of weight. When I saw her in person, I knew something was wrong. You know, like I knew she had never lost that much weight before. So, you know, she lost a lot of weight. But you know, that was good too. Yeah. So I did get to, you know, while we were waiting for that, we did get to bond as a family, just an anchor to our faith, just whatever was ahead.
Yeah. Was it your idea to schedule family photos? Because that's very interesting to kind of capture the moment, because you don't know what's going to come, but you think something's going to come. Was that your idea? And how did you think of it if it was?
I don't remember whose idea it was. It's almost like you don't know like what's going to come. You don't know, right. You know, and it's almost like, oh my gosh, is it like a morbid move to like, you know, go take family photos, thinking right. You know, honestly, like at the back of my mind, there was that thought, like, is this the last time we're going to take family photos? But in the moment, it was such a good, like, it was so different from what I thought it was going to be, like, in terms of that experience, that, like, you know, you're just really, it was just like a bonding moment, like, almost forgot about it all, like, forgot about the crazy and, like, the diagnosis in that moment, and just kind of enjoy just being together. And, like, you know, I was like, oh my gosh, everyone gonna have sad faces on, like, you know what I'm thinking? You're like, are we gonna be in the mood to take photos right now? And everyone was, right? We just kind of compartmentalized it and just took these photos. And, you know, and then having like an infant in the mix of it all kind of like lightens up the mood in the room.
Yes. So I have an interesting question for you. So now, in retrospect, when you look at those photos now today, what does it make you think? What thoughts go through your head, or what feelings do you feel in relation to those photos, looking at them today?
That's a really great question. Sometimes I see them and I'm just, it like brings back the emotion of like how much like right before that, the immediate, like how your life totally changed. Like, you know, days before that. So just like, you know, you think about pre that moment and then post that moment and kind of where you are now, you know, just, I blew up those pictures like in my house, like, you know, the process of it all, like, you know, right before all of this went down, I had bought a new house, you know, and literally like bought a new house, and I didn't even have time to like move in it or live in it. So like we just literally, I dumped all my stuff in there, and just went to New York. So like when I settled back into the house, and like, you know, we do like cultural things where we do like a housewarming with our parents where they come in, like bless the house and stuff. I like blew up some of those pictures. It was like the first time actually seeing them off a screen. And like, so now seeing them back, it just kind of brings you back to that moment. You know, it's a different feeling like than what probably was in that moment, but it's like kind of reminding you of like kind of where you've been and where you are.
Yeah, no, thanks for sharing that. Your story just reminds me that cancer doesn't have the best timing, right? You said your brother just got married, your sister just had a baby, you just bought a house, and then cancer enters your life and then just changes everything for everyone. So the timing is just crazy. So you're now moved in with your parents, taking care of your mom, taking her to appointments, I imagine, talking to healthcare professionals.
Yeah.
Now, you being a healthcare professional yourself, you know a lot, and you know the healthcare system. What was your biggest challenge? Like just looking back as being on the other side, so to speak, as a caregiver in the oncology space.
Yeah, I was shocked at the lack of patient advocacy. You know, like, I mean, let alone like caregiver advocacy. I mean, like the initial diagnosis, I mean, I guess what I didn't mention was the initial diagnosis went from, you know, metastatic pancreatic cancer to, it was actually lymphoma. So like, remember that differential that I presented to that doctor? They're like, this is, non-Hodgkin's lymphoma. So like that was her diagnosis, which has a very different, like, you know, goals of treatment than, you know, metastatic pancreatic cancer.
Yeah.
So that was another like roller coaster of emotions. It, you know, like going from something that's completely terminal without a cure.
Right.
And you're thinking hospice and like pain management and, you know, this, you know, I just remember so many different things. One of the things were
So you got the diagnosis, non-Hodgkin's lymphoma. It was not metastatic pancreatic cancer. Yes.
Yeah. So that's like, again, another shift of, so for those that may not know, with non-Hodgkin's lymphoma, like the treatment is to cure at first, like with curative intent. So that's a whole nother mind shift. You're like, move from like, hey, we're ready, and kind of accepting this crazy life altering. I mean, cancer is, no matter what it is life altering, but what does that look like? And I remember my mom's initial like diagnosis, like symptoms were like she had severe pain, and she doesn't take like Tylenol, Motrin, really, like she doesn't really take meds like that. I remember the doctors just like thinking about like being a pharmacist, thinking about what type of pain meds they were going to put her on. Yeah. I remember immediately they went to morphine, and just being shocked by like that, like is what we're going to put. Like this woman hasn't taken Motrin.
Right.
Let's like do a stepwise approach. And thinking about like, I just think about if someone with curative intent, if they got hooked on something like a narcotic drug, the impact of that. Right. It's just little things, like the shock of like little things like that. Obviously you want to make sure the patient that has cancer is comfortable.
Right.
That I totally get that. But like you also gotta, I guess at that point we didn't have a real diagnosis. And the long-term implications of some of those decisions up front. I mean, and if you're not in healthcare, you wouldn't challenge that. You would have just gone by it because it's probably, for short-term management and quickest onset, that's a really great drug.
Right.
But like,
right.
But the abuse potential and coming off of that, like not knowing on the tail end that this was lymphoma and she could have gotten cured, like getting stuck on like a narcotic drug like morphine or anything harder like oxycodone would have been like another complicating factor in all of this. So
did you find yourself advocating for your mom a lot? Yeah.
I don't know. I hope the doctors appreciated it. I didn't come into the picture kind of being like, I'm a pharmacist that's an oncologist, like I know it all. Right. But where I thought there was questions, I would challenge. Where there was opportunities for clinical research, I would ask. Mm-hmm. I was just surprised on the patient advocacy part and the caregiver advocacy. There was like really nothing for me.
Yeah.
Or my family. I just remember us really thinking about what are my mom's needs, what questions does she have,
Yeah, so question about you being in the healthcare field and your mom being a nurse, also in the healthcare field. Do you feel like they still took the time to explain things to you, whether it's a diagnosis, treatment, Because I think assumptions can be made because like, oh, well, you're an oncology pharmacist. You should know this. You know what I mean? Mm-hmm. Did you find that they made those assumptions after they kind of figured out, what you do for a living?
Honestly, I don't think so. I felt like while I was in the room, they kept talking to my mom, which I appreciated that. Mm-hmm. Mm-hmm. Sometimes, like big personalities can take over, like they are kind of in charge. Like my mom had all of her decision-making like abilities. So like they talked to her directly.
Right.
Which is really good. Like before we even knew what it was, we also like as a family talked to her about, what was her wishes, like what did she like, even because going down like cancer treatment, like a cancer path and treatment, like depression is a real thing. Right. So like, sometimes like that can cloud your judgment and decision making. So like we wanted to make sure as a family we knew what she wanted, while obviously we all wanted her to fight. I'm sure that was a part of it too, and she definitely did that partly for us. But there were some tough roads ahead, and there were moments that like the patient just wants to give up. Right? Yeah. Just kind of knowing what she wanted from the initial beginning, kind of pulling that through for her as a family, like all of us, even though at points like I became the healthcare proxy, because I had to make decisions, right? So like just continuing to lean into what she wanted at the end of the day.
Okay. Yeah, no, that's good. And those are the hard conversations to have. Mm-hmm. So that's good that you and your family are better come together and actually have the conversations and pull it through for your mom to really advocate for, what she wants. So that's awesome.
For sure. for sure.
So in the hospital, what could have made your experience better or improved your experience being the caregiver for your mom? Is there anything that, just looking back in retrospect, that the healthcare providers could have done, any services that could have helped you?
You know, there was a point in my mom's like treatment where she ended up being hospitalized because of a serious medical condition.
Mm-hmm.
So she had to undergo surgery for all of that, and like that, there's complications of that that required almost a 50-day hospital stay. Yeah, so that I was pretty much by her side 90% of all of those 50 days. There would be times where, you know, like I would be able to step away. Like I was also working full time during this entire, like, you know, I hadn't given up my job at this point. And for me, like, I couldn't just sit there by her side and just, if I didn't have a real role to play, and if I can concentrate on something else, like to keep my day going and just keep my mental health, or like keep me mentally stimulated on some other things, that's how I could just kind of keep going. I remember, you know, if there was something taking over that day, it was just super serious, or I would just take off from work because I needed to. And, you know, my employer at the time was just super supportive of that, supportive of whatever I needed. So they were really there, and so were my colleagues. So just friends and family really played a big factor, because at those 50 days, I was in New York City. So my mom was getting treated at MSK in the city, and my dad was living in Long Island. So like, honestly, like I have no idea. My mom's the caregiver to my dad. So like the whole role kind of reverses. Like, you know, he can cook things to sustain life, but I don't know for long periods of time. So like family givers, like family members that came and provided food, and, you know, when they, you know, asked what we needed, you know, really tell them what you need. You know, in the beginning it was tough. It was tough to just be like, you know, you're just thinking this is just a formality. They're just kind of saying that because they have to, and you really don't take them up on things until you get to a point where you're just like, yo, I can't do everything. I cannot be feeding my dad at home in Long Island and making sure my mom's not coding in the hospital in the city. Like, you cannot do everything, right? So you just kind of have to lean into the support when people give you that support. What could I have differently? I wish, like, you know, looking at those 50 days in the hospital, I wish there were more resources for me to find like a place to stay in the city. You know, like sometimes, you know, there's different types of cancers that require infusions in the hospital, or a transplant. Like, you know, during that time, I think for those like specific types of cancers, there might be support built into the family, or like housing for family, because they need to, like, it is known that that type of cancer, you need to be close to a hospital. Not everybody lives close to the hospital. So like they've got those resources for those patients and those families. But there's like unforeseen hospitalizations where, you know, you now need to be near the hospital. You know, one of the things that I learned by like hopping around different hotels in the city is that, you know, if you tell them that you're there providing support for a caregiver, you're a caregiver for a cancer patient that's your family member, like they give you different rates. No one told me that. No one told me that, you know. I do remember like friends just kind of like looking around for rates for me, or like resources for me. Like there was nothing like systematic in place at the hospital that I could have gone to, like, a caregiver hub to get all these type of resources. I mean, that would have been awesome if I had like a location at like MSK, because literally I spent hours, days there, you know?
Yeah. So even while you're in the hospital, no one ever like spoke to you to say, hey, where are you from? Do you need somewhere to stay? Right. They just,
no, they saw me every day. And, you know, with the guy with the laptop in the corner, you know, because I was also working from the hospital. So just kind of like, you know, I think back to that, and I think back, there's got to be other people that have this experience that, like, you know, are trying to take care of their family member, also trying to work, trying to balance all these things. Like, you know, how can I give back to those type, like someone in my position that might be going through it now?
Yeah. Yeah. And that's the thing. Life still goes on, right? While you're going through this time in your life. So very interesting. So Saju, where did you go for resources or an outlet? Like, did you go online? Did you try to look things up? I know you said like hotels and where you stay and, you know, working, but did you ever kind of settle down and actually look for an outlet, whether a person, a group, a community?
Yeah, I mean, I had really great friends, of which one of them were you, Wendy. You know, it was really great to be able to, you know, I'm not like, you know, as a guy, like I don't get emotional. I don't cry. Like that's not things like, you know, even in our culture, like we're grown up to for that to be okay. And like, you know, that's just not who I am, but being able to just kind of break down with those that you are like most comfortable with, like you know, like let your guard down, and those that you trust, those are that are reaching out to you, really lean into them. I think it's super important, like even if it means like, you know, just in the beginning, like while I'm a healthcare provider and I've been working in oncology, you know, just offering up, just getting on the phone with me, like answering, you know, just listening to the, you know, the initial conversation with our medical oncologist that was going to tell us about the treatment options in this space. Like while I was in oncology, I worked in prostate cancer, right? I was at the time working with hematologic malignancies such as lymphoma. And Wendy, being that you were, like, you can like be that healthcare person that I can trust, like to ask questions that, you know, you're kind of processing, right? You're kind of processing as no longer a healthcare person, but more so a family member that's, you know, you're in the receiving seat of things, which totally, like, you know, I have a whole nother appreciation for, you know, like, you know, when you're when you're the healthcare provider, you're just thinking about the drugs, the process, the infusion, like, I'll be honest, sometimes you forget about the person sitting in the seat. You forget about the person holding the hand.
Right.
Like, you know, like it's, you know, and I mean, for me, it took me being that person to like think about that, and like think about, like, you know, all the things that you're doing as, you know, for the caregiver community. Like, you know, it's awesome.
Yeah, thank you. Now, do you feel like that would have helped you during your time if you had a community like the Cancer Caregivers community on Facebook? Do you think that would have helped? Would you have time to like log in and kind of do a check-in, or are things just kind of just going?
I think realistically things are just kind of going, you know, like I think if it was there, I could just like shoot a message into the group and be like, hey, I have no idea where I'm staying tonight. Do you guys know any like good deals or for like a hotel, you know, or Airbnbs? Like sometimes based on like the holiday weekend, like it was like hundreds of dollars for a night, you know. I remember taking I remember being in one hotel room. I was able to stretch my arms out and almost touch both of the walls. And literally there was a bed in the room and like enough space to walk around the bed and go to the bathroom. I was like, this is interesting. But
gotta love New York.
You just again, you just make it work, and you're just like, honestly, I don't even remember. Like, I remember going to bed, so there was an app. MSK has an app where you can check labs and like vitals and everything. Like, so like I was always living by that app, just kind of looking at, like, they would do like 6-hour, like, you know, lab work or 12-hour lab work. I'm like checking, hey, what are my mom's labs in the morning? I wake up in the morning, the first thing I do is time to opening up that app and checking the lab work, like, where are we at this morning? So that's kind of like, you know, that was a great resource too. But I don't even know what your question was anymore, but
that's okay. So while you were caregiver side, did you ever take time to kind of just figure out how you're feeling or what you're going through? I know you said there were people that you were able to kind of open up with, be emotional, but did you actually take time, whether at night by yourself, to just, or were you just constantly going?
Yeah, I was just going. I was just going. I feel like some of those feels came after the fact. Like after, like almost like post-traumatic stress, like PTSD. Like I don't remember like being super upset or super emotional or breaking down like during those days. I mean, you're just in this mode of like, we're gonna get through this. We're gonna get through this. Like, you won't even like allow yourself to like think negative thoughts until like someone super close to you starts to like break down too. Then you just start to get those like worried feelings too. Like, and then you're like, your siblings break down, you're just like, okay, I have to be this rock here for them. Like they cannot, like I
Right.
can't even break down here too. Like, because there were days in the ICU from that hospital stay, like they had no idea what was going on. They had no idea. They were pretty much throwing the kitchen sink at my mom to like try to get her to recover from some source of infection that was somewhere in her body. Like,
Right.
And her respiratory rate continuously keeps getting worse. And, they're talking about intubation and CPAPs and like, I literally like you're sleeping, waiting for the call at night where they need your permission to like intubate. Right.
Yeah.
So like, that's kind of how you're like, in those hospital days. I remember being in that ICU like waiting room, like just thinking about just like, and then the families all around you, like where patients are like not making it through their like ICU stay, and you're like, it's a really tough place to be in. And like I just remember like calling my siblings up, like where like they did the best that they can. I knew they had a lot on their plate too, but just like some days were so tough, just like sitting there and waiting, like, and you couldn't go anywhere because they don't have a phone number. They're not going to chase you down,
Right.
the people, the clinical team, and you couldn't be in the ICU room. I couldn't be in the ICU room because my mom had like infection that was, you had to contact precautions. Like I couldn't get sick, right? Like I couldn't get sick, then there's really no one here.
Right. Right.
So,
You're it.
Yeah.
Yeah.
So like, I think I just remember like some of the overwhelming days or feelings, like when you're like being surrounded by like, I guess, death. That's what it was. Like in the ICU, there's like people just don't make it out of the ICU, and just the pain of like the other family members, like you're not talking to them about your pain, but you can see what's happening, and you're like, is that going to be me tomorrow? Like that's what you wonder, and like those days, like where things got really scary, or like it was tough for me, I would tell my family to get there that night, to just come, and I cannot do this by myself.
Yeah, good for you. Good for you.
You just have to like reach out, or like I had friends that worked nearby up in Montefiore, like grab a drink, get lunch. Like you forget to do basic activities like eating, showering, taking care of yourself. I mean, you think this is the things you'll do this, but like after a long day, like in the hospital, the last thing you just want to pass out and wake up and do it all over again,
Yeah.
So.
Yeah, no, thank you for sharing that. So as we start wrapping this up, Saju, what are 3 things you would tell someone who's currently providing care to someone with cancer?
Oh, wow, that's a tough one.
Well, you're so you provided care. Now your mom is good, right? She's in remission.
Yeah, that's we didn't even hit on that. Yeah, my mom is in remission, guys. Like,
yes.
That's a good news story. God is good.
Yeah, he is.
But like the reality is, like the one thing like I want to touch on, like I don't think we addressed it enough, is the fact that like what you've been through, you can still be impacted by that. Like people think, oh, your mom is done and you're good and everybody's good. Like, no, like because like I probably didn't process the feelings that I need to. I probably should have seen a therapist. I remember my friend Wendy telling me to see a therapist, but that's not the priority. Like at the time, like that's not like, let me take care of myself isn't the priority. It's not what you're thinking. And Michelle said that too, right? Like it's the same type of mindset of, I am not the priority anymore. This person is. Like, but the thing is, like when you're taking care of somebody, if you're not at your best, like you cannot take care of that person, and so like after the fact, when diagnosis is done, and if you get to a place where the person's better, or they've moved past on, like and you feel like the pain and of all of that may come at another time, may come by looking at a picture, like those pictures, like sometimes I see them and then I like break out in all sorts of like waterworks, because like it is that much like of a shock of like what has happened to your family. You sometimes the questions of why did it happen, and then like, there's cycles. Like my mom gets scans every 6 months. Like, as we get closer to the next scan, it is tough. It is really tough. It's like, I'm not even the person. Like, I can't even imagine what's in my mom's head. I can't, like, I ask her and she's like, oh no, I'm fine, I'm fine. I'm like, are you sure you're fine? Like,
The mom.
I'm not fine.
Right.
How are you fine? She like plays it off like she doesn't want to bother me about like any type of like, when she's not feeling great, like she knows like my antennas are gonna go up the moment she tells me she has a stomach ache. Like, that's how it started, right? So it's almost like that's where it started. That was the first symptom. So like, no stomach ache for anyone in any, like, when anyone tells me their mom's not feeling well, there's weight loss and there's some of these symptoms, like my first thought is like, what happened to my mom?
Right.
And I don't want to tell them because it is such like a crazy like thought. Like, that wasn't what I thought. My thought, it was just like a stomach virus, right? Like,
right,
I don't want to think about that. So like, everything's gonna kind of like set you off like moving forward. I mean, at some point I think maybe it'll get like less work, like less impact, like it won't be as crazy of a feeling, but I think it's really there, and I think it's really important to talk to your family about it or talk to someone about it. I think you're still processing. I'm still processing, right? So, and just the reality of it all. And yeah, I mean, and I have great friends that I can openly talk to about this, which really, really helps. I think, talk about it. If you don't have someone that you don't feel comfortable talking about it, write it down, right? Like, journal. I think you mentioned that before. I think that's a really great outlet, because then you can think, like, you look back. I mean, your life is your life, and like, you go through different things and just kind of look back and, you can see that. Other advice for caregivers, I mean, I think just taking the time to care for yourself, another thing that I did, my family did, like, before, like, they knew I was going to step into this healthcare provider role, like caregiver role for my mom. Before she started her treatment, like, I had a trip planned overseas with one of my friends before all of this went down. And I really didn't want to go. I did not want to go because I wanted to be there for all the decisions, and I didn't want to miss, her first treatment. Looking back, I mean, I think it was a good thing that I went. There were some tough days on that trip, that, like, my mom did end up getting her first cycle of her chemo, like, while I was gone. I mean, at the end of the day, there was nothing I can do other than be by her side and hold her hand, right? So that was tough, though, because you just never knew, like, it was she had to be hospitalized for that actual cycle because there could be a potential reaction there, and just kind of that whole day was just, I couldn't enjoy that particular day. But like, outside of that, it was really good to kind of get away, just get your mind kind of prepared for the months ahead, because it's a lot. So if you have the time to just, like, step away and just recover, do that for yourself. I know in the moment it might feel selfish or seem selfish, but like, I was able to do that a couple of times. Like, the trip was one of them. I go away for work. I travel for work sometimes. So like, that while it's work, it almost was an escape from what was going on at home, right? So like my coworkers were just like, you don't need to come, you can Zoom in, or it was pre-COVID. So they're like, you can Zoom in and be there virtually. I was like, no, I need to be there. I need to step away. Everything seems to be okay. But, and then sometimes, like, you'll feel like it's all falling apart the moment you step away. Like, I felt that way. Like, the moment, like, I stepped away, she ended up in the ICU. The reality is, like, she would have gone to the ICU if I were there or not, right? Like, it's just kind of the outlook of it. It's not like, you don't necessarily control the events, right? All you can do is do your best, be your best, and take care of yourself. Like, I think that's so, so important. Yeah, and give yourself the grace that, sometimes you won't say the perfect thing. Sometimes you'll snap at your family members. I mean, you're trying to do all things, work, be there for your mom, not like show emotion in my case. And sometimes you'll snap, and, just, you'll just move past it. Give yourself the grace that you will mess up or something might fall through the cracks. But at the end of the day, you're doing the best that you can.
Yes, no, that's really good advice. That self-compassion is vital to, hug yourself, right? Give yourself the grace, give yourself the time and space to kind of process. So yes, and something you said I wanted to just highlight. You said that now that your mom is in remission, you're still very stressed and anxious even with scans. And in the research, it shows that once patients go into remission, the caregivers have higher levels of anxiety than the patient. So I think that's very interesting that you said that.
Yeah.
So, yeah.
And again, it goes back to the science, right? Like, because I actually have, the privilege of working with hematologic malignancies. Like, I work with on clinical trials for lymphoma, which, is a full circle moment for me just to like do that. And like, I'm honored to be able to work with those type of clinical trials to like make an impact or a difference in patients that had the same type of cancer as my mom. I'm so privileged to do that. I totally lost my train of thought, but
that's okay.
Yeah, I mean, at the end of the day, yeah, I mean, I have no idea where I was going, but
No, that's okay. It came full circle. You currently work for a company that works with heme malignancies, and you feel honored to work on those trials, which is awesome. That is full circle.
Right. Oh yeah. So like, what I was gonna say was I know the data a little bit more, and because I know the data, that I'm like, okay, when we hit the 2-year mark is when I'm gonna be able to relax a little bit. I don't know if I'll necessarily relax, but that's just because, again, I'm the healthcare provider that works in this space and I know the science. I get stressed out, but I'm still the optimist. I'm still thinking, we'll constantly think positive and honestly lean into my faith. While there is a science, like my faith has really gotten me through it. So like, if you do, whatever your faith is, whoever you believe in, I think really like lean into that too. Like, it could get you through these things. And, like, while the medicine is there, like, I truly believe like a part of it, like my mom had very bulky disease and pretty aggressive. And I do believe that it was some form of a miracle that she's in remission right now, after 4 cycles. Like, she didn't even complete all of her cycles either. So I believe that. I truly believe that. So does my family. So.
No, that's awesome. That is great advice, Saju. Thank you so much. So we're going to wrap up. Any last words? Anything you want to get off your chest? Anything you want to say before we close this interview? This has been great. Thank you so much.
No, I think I've said a lot of different things. I mean, I think there's like different perspectives from different like time points of like this journey. Pre, during, hospitalization, post, like, I think it's a lot. It's like a whole journey, and I'm still on it. So I like the fact of like exercising and caring for yourself has been something that I prioritize now. And this group does help, right? Just taking the minute to pause and breathe and just take that time each day. Setting up like, routines for yourself. Like, a lot of last year, like I, wasn't eating healthy because I just was trying to get the meal, whatever meal I can get in. I wasn't exercising. So just kind of focusing back on me while I still care for my mom and always checking in on her, like prioritizing you. And if someone's out there giving care to someone else, like just prioritize you too,
Yes, absolutely. Yeah. And that was really the whole foundation of Shape Partners, was really to be there on that journey with caregivers from start to finish, just to help them through, to have an outlet, have a community of people or someone to talk to. So thank you so much for that, Saju. Thank you for your time, Saju. This has been great, and I'm sure we'll talk again soon.
Yeah, sounds great. Thanks, Wendy.
All right.
Thanks for having me.
Thank you.